Alcott, and I am a member of IATSE Local 476 Studio Mechanics in Chicago. IATSE is the International Alliance of Theatrical and Stage Employees. I work in film and television. I do not represent my union. I am a rank and file member, and I am an organizer and a volunteer for Medicare for All and Labor for Medicare for All. I went on the trip with building relations with Cuban labor for the May Day delegation back in May of this year. And it was a really great trip. I've always wanted to go to Cuba for many reasons, and I wanted to go to Cuba also to learn about their healthcare system. We went to a hospital called Felixito Garcia. Is that how you say it, Julie? And we brought some suitcases of medical supplies to donate to them. And we met with doctors and students at the hospital. It's a university and trauma hospital. And healthcare in Cuba is completely free. They see healthcare as a civil right, and it's a part of their constitution. And which is awesome. They have to deal with a lot of issues due to the embargo. And they struggle with getting the supplies and equipment that they need, but they try to make do with what they have. They train a lot of doctors from around the world, and they also send doctors out, like we saw in the video. They send doctors to underserved areas, to developing countries. They've been training and sending a lot of doctors to Gaza recently. And it was great to meet and talk with the doctors and the students, because it's just a totally different worldview when it comes to healthcare. And when the doctors they're treating people in Cuba and also going around the world, they're sharing the values of national healthcare and community healthcare. And when we were meeting with the doctors, we had a few minutes to explain what healthcare is like in the United States, and we used the term for-profit healthcare system, and they did not understand what that meant. And it's difficult in many ways to have a healthcare system that's a business. And even though we have all the resources that we need in this country, a lot of people, even if they have insurance, have trouble accessing the healthcare that they need. And it's, I guess, thinking of healthcare and labor. I work in the film and television industry, and a lot of film work has left the United States. There's a number that people use. It might be a little inflated, but it's about 20% of film production has left the United States since 2023. And a lot of work goes to Canada, England, Australia, and Eastern Europe. And when productions go to those countries, studios don't have to pay for their health insurance for the workers there. And that's one way that a lot of workers here in the United States are losing out on work, is because in order to save money, we're losing work to other countries. And health insurance weighs heavily during bargaining. And in terms of labor and in terms of workers' needs, if we had nationalized healthcare in this country, it would help so many people. And thinking about international labor solidarity, wealth disparity is an issue across the entire world. And through organizing and through international solidarity, workers can fight capitalism and imperialism. Thank you.